Hi, I'm Laurie Isenberg, and for the last year and a half, I've had the privilege of being a board member at the National Coalition of Cancer Survivorship. And my background is business, and I've had a wide range of business experiences over the last 30 years. And at the time of my cancer diagnosis, which was 11 and 13 years ago, I was working for a management consulting firm. And so that's really the lens and the perspective that I've approached survivorship. Um, and in talking about policy-related solutions for survivorship care, I'd like to talk first about the work that NCCS has done and is doing with respect to policy and survivorship care, and then some of the work that I'm doing at UCSF related to survivorship. So at NCCS, we have and continue to focus on policies that are critical to survivorship. Yesterday, we heard about the Lost in Transition report that recommended, that had the recommendations for survivorship care plans at the conclusion of active treatment. And while the Commission on Cancer has made this requirement for accreditation, we all know the adoption has been slow due to a variety of reasons. We've long advocated for adequate payment for the creation of survivorship care plans, really just recognizing that the creating and delivering of plans and everything that we've talked about in the last day and a half, that comes with the value of having planning. We know that it's obviously not reimbursed, so we've been long advocating on that front. And in the last Congress, we advocated for the Planning Actively for Cancer Treatment Act, which we call the Pact Act, which would establish a cancer care planning service in the Medicaid program. And this service would be available to cancer patients as they and their care team, it would be available to them as they are doing active treatment and beyond active treatment when there's a major change in their treatment and for long-term survivorship. So the cancer care plan available throughout the cancer care journey, this PACT Act would enable there to be shared decision-making about the patient's cancer treatment and encourage a multidisciplinary approach to treatment and symptom management, and of course improve, as you know, we've all been talking about long-term survivorship care. So the status was that the legislation has not been introduced in this current session, but we plan to pursue it next year. So this year, in 2017, we've been advocating for affordable coverage of those with pre-existing conditions. Obviously, we believe this is critical to all who are diagnosed with cancer, living with cancer, and its side effects. In doing so, we coordinated, one of the things we've done is coordinated with more than 30 advocacy and care professional groups to voice our opinion that improving the quality of care for survivors obviously begins with access to affordable care. And finally, to support survivor share policy, we, every year on an annual basis, we work with patient advocates on issues that will help them work on a local and national survivorship policy level. One of the things we do is we have an annual meeting where we bring in experts to present on the key issues related to survivorship. Many of the issues that we've discussed at this conference, like healthcare financing, patient-provider communication, and other issues. The advocates learn how to share their stories so they can be more effective in working on both national and local levels. We visit the Hill, we help them visit the Hill so they can visit their representatives and tell their stories. They learn how to get involved in improving care in their local communities as well. And as many advocates as there are different reasons why they're getting involved, and it's really been rewarding to hear their stories and have their stories shared with each other. And another part of these meetings with advocates is that we bring in medical students who have expressed interest in oncology care, and they meet together and they each share their stories about communication. And the whole idea, obviously, is that that's going to foster better communications between the provider, that with talking with budding medical students, that's obviously going to hopefully spread and just grow in that area. So these are just a few of the examples that NCCS does to be more involved in survivorship policy issues. And so next I was going to talk about a little bit of the work that I'm doing with UCSF on the survivorship level. And I was treated at UCSF many, many years ago. And at that time, as I mentioned, I was working in management consulting. So I didn't even think about survivorship issues. I just jumped in and started helping the breast care center work with some information programs that they had underway. One of them was they were launching a national breast cancer clinical trial service. So I was able to help them with those launch plans and some of the strategy around that and reaching out to different partners. And then along the years, I've sort of stepped in and out. And a couple of years ago, my oncologist reached out to me and said, hey, I'm interested in some survivorship issues. You're interested in, I didn't couch them in survivorship issues, but it had to do with wellness issues. And she knew that because we had ongoing conversations. So what I came to find out that as UCSF is this really amazing care facility, obviously, that their survivorship services, while in breast cancer, I saw they were seamless. I didn't realize that I hadn't received a survivorship care plan per se. I just created one on my own. But what I came to realize is that across the center, there wasn't an integrated service at all. And while programs would come and go, there was nothing that was sustainable over time, which I soon found out was the result of not having consistent funding. So at the time, what I did, and I'm just going to briefly go through what I did and what the results were, is from a business perspective, I asked them if there was any research that had been done on other survivorship programs, and the answer is not in the last 5 years. So I set out to look around the country at like-kind comprehensive cancer centers and say, let me figure out what's working, what's not working. And so I reached out to a few of the large programs. Mary McCabe, thank you, gave a lot of her time to me, as did others, in helping me understand how they started, what their structure was, what some of the guidelines were, components. I looked at program funding, both to initiate their programs and also on an ongoing basis. What was their scope of cancer? What complications did they run into? And what were some of their future plans? And so I was going to tell you about, before this morning, I was going to tell you about some of the insights and that affected policy. But in truth, this is what happened is, my notes got totally just scratched up. And so what I realize is that there are a lot of successful models. It's not just some of the big institutions, but thank you to all of the speakers this morning, because I learned a tremendous amount. And there are a few things that I did learn. And so I've scratched off half of them that I'm going to tell you. But the few is that the first one is that first and foremost, many of the successful survivorship programs all had, the large ones, from the large institutions, all had a major source of funding to jumpstart their efforts. And so that was really key to understand as I was trying to participate in launching this integrated service at UCSF. And as somebody wisely said, and we've heard this yesterday, survivorship doesn't make money, but the oncology practice does. And as a management consultant, you always think of different models that relate to that. And all I could think is restaurants make their money off of alcohol, not off of food. And so it seems to be similar, although obviously much more serious. Another insight was that, and maybe it just seems so obvious here, but that the philosophy and culture of the institution must be that survivorship is a critical part of long-term patient care. And for any cancer center, just building a better quality center, it just needs to be an integral part of care. The existence of a passionate champion, and I think that was exhibited so clearly this morning, to have a passionate champion or champions of programs who work with the program depth and breadth and evolution, incorporates research, and most importantly, as everybody has pointed out over the last day and a half, is listens to the patient, obviously. There are a few other things. What I'll never forget, what Mary has said to me along the way is be patient, be patient, be patient, and hang in there. I loved what I think Meg said this morning about survivorship is really the tail wagging the dog, and somebody else may have said it yesterday. Start with what you have, which I think is very instructive. And so there are also other issues, building an embedded model where other care providers evolve into survivorship specialists. This is, obviously, these are drums that are being beaten across the country with tactical survivorship models. What I guess I would just like to say in summary, and now I'm going to sound like I'm beating the same drum, but I do think it's true, is that survivorship programs, treatments, and services for survivorship care need to be viewed as essential care and have the appropriate funding and reimbursement in order to sustain long-term programs and to have them, well, to sustain long-term programs.
Thank you.
Thank you.